In October 2009, the National Black Leadership Commission on AIDS, in partnership with the National Medical Association, the National Conference of Black Mayors, the National Caucus of Black State Legislators, and the Congressional Black Caucus Brain Trust, with the generous support from Abbott Laboratories, convened a 2-day public health summit for black clergy. We call this gathering the National Conclave on HIV/AIDS Policy for Black Clergy. I was proud to co-chair this conclave along with Bishop T.D. Jakes of the Potter's House of Dallas, Texas. The conclave was convened to allow over 150 black clergy and other leaders in attendance to develop a plan of action to address the urgent HIV/AIDS prevention project, treatment and care needs of the African American community nationwide. The Black Clergy's Action Plan led to the development of a bill known in the House of Representatives as H.R. 1964 and in the United States Senate as S. 3011. It is the National Black Clergy for the Elimination of AIDS Act of 2009. Black America is in the grip of one of the most devastating public health crises in our lifetime due to HIV/AIDS. Year after year, epidemiological data from the National Center for Disease Control and Prevention and local health departments from coast to coast confirm that African Americans continue to be disproportionately infected and affected with HIV/AIDS. The current HIV/AIDS related public health state of emergency impacting the black citizens of the District of Columbia paints a portrait of what is occurring in other black communities, large and small, across this nation. We are here today, strong in number and conviction, to urge the 111th Congress to pass this landmark bill as expeditiously as possible. We especially want to thank Congressman Charles B. Rangel for his leadership in supporting the bill and securing the co-sponsorship of Congressman Peter King of New York and an additional 41 members of the House of Representatives. Congressman Rangel introduced the bill in the House in April 2009. We also want to thank Senator Kirsten E. Gillibrand of New York for introducing the legislation in the United States Senate. Through their actions, these leaders have demonstrated their commitment to addressing the urgent, often unmet HIV/AIDS prevention, treatment, and care needs within the African American communities of our nation. It is a moral outrage that HIV/AIDS continues to disproportionately wreak havoc on multiple generations of black Americans. We account for 12% of the nation's total population, and yet we represent almost half of all new AIDS cases and an estimated 45% of new HIV infection cases as of 2007, according to the CDC. As a body, we are in support of expanded HIV testing so that all Americans between the ages of 13 and 64 know their status. We need voluntary routine HIV testing in all appropriate medical settings. We must tie efforts to expand HIV testing to the implementation of a science-based national media outreach campaign that urges all Americans to know their status. However, special emphasis must be given to black men who have sex with men, women, and youth, segments of the population where the CDC's and local health departments' epidemiological data indicate the need is greatest. We must have enhanced HIV/AIDS prevention outreach that is targeted to the subpopulations. We must provide support for culturally competent research to develop behavioral strategies to reduce the transmission of HIV/AIDS within the African American community. We must have expanded and intensified HIV/AIDS educational activities that target black men who have sex with men, women, and youth. To ensure that these activities are culturally competent, we recommend in H.R. 1964 that these activities be coordinated with black organizations, including faith-based organizations and institutions and historically black colleges and universities. We also want to voice our strong support for efforts to pass health care reform legislation now. Passage of this bill will help make a dramatic difference in the lives of people living with HIV/AIDS, many of whom are uninsured. So I want to thank you all for joining us here today. And I want to say this. I've just been informed that Washington, D.C.'s Mayor, Adrian Fentry, has just released the city's annual epidemiological report on HIV and AIDS. I'm very pleased to hear that for the first time, the city has experienced a decline in new AIDS cases in the district. Reverend Tucker, this decline has been credited to an increase in prevention, education, and testing. And it is an important indication that with the right resources, we can make a difference. Passage of 1964, with its emphasis on testing, prevention, and education, will result in similar success stories in other cities across the country. I'm here today along with the Congressional Black Caucus, our local elected officials, our clergy, our social and civic leaders to say to you that we stand firmly behind H.R. 1964, and we need our congressional representatives to sign on to this bill, get it through the Congress, and make it law. This is most important to the survival not only of African American women and children and men, but to all of the citizens of our nation. And finally, it is absolutely divine intervention that we are here today at a time when our nation is faced with making one of its most important decisions, and that decision is to pass health care reform so that the majority of the citizens of this great United States of America can be comfortable in their own nation knowing that their health needs will be met. We support our president, we support those who are working hard for this legislation, and we are sure of victory as God is our witness. Thank you very much. Now, we have with us today, of course, to my right is the distinguished chairperson of the Congressional Black Caucus, and to my left is the executive director of the National Black Leadership Commission on AIDS. I'm going to call on our executive director to come before you and make any statement, and then introduce our chairperson for any statement she may make, and then we will answer your questions.